All right, everyone, we're going to go ahead and get started. Welcome to tonight's seminar, and I'm glad that you're here. I just want to go ahead and say thank you for taking the time to listen to the information that we're about to present. This information is extremely important, and I can't stress that enough. As a chiropractor, people come to me because they have back pain, neck pains. They want to take care of their spines in some cases just for prevention, which is awesome. But the reality is that spine disease is not the reason why my patients will die. Statistics show that the #1 cause of death in this country is heart disease. Second leading cause of death is cancer. And both of these conditions are silent killers, meaning you don't know you have it until it's too late. And so that's why as a doctor, I want to spend time educating and teaching my patients anything that they can do to reduce the chances of them suffering from these conditions. Today, thousands of people are going to end up having a heart attack. Yesterday, they thought they were fine. Last night, they were having dinner with their families. They were playing with their kids. And it's unfortunate that today, so many people are not going to be able to go back home and have the same kind of evening. And that just, that's just not right. And so that's why this information is so important. And if there's anybody that you know that is at risk for this condition, which basically is 50% of the population out there, please send them this link, or please send them to our website, or please give them my phone number, my email, and I'd love to be able to talk to them and help them out any way I can. So this is the Great Heart Disease Myths Seminar. I call it the Great Myths Seminar because there's a lot of myths out there regarding heart disease, and so hopefully after today we could dispel some of those. So how devastating is heart disease? Well, according to the Centers for Disease Control, it's the #1 cause of death in this country. So 50% of deaths in this country are because of some cardiovascular event, which includes strokes, heart attacks, heart arrhythmias, inflammation or plaquing of the arteries, these types of conditions. That's about 600,000 deaths every year because of heart disease. 75% of those affected have a heart attack prior to diagnosis. So they call these first heart attack cases, which basically, like I said, today so many people are going to end up having a heart attack, and the majority of them, 3 out of 4 or 75%, had no idea that they actually have this problem. And so that's why they refer to it as a silent killer. One person dies every 39 seconds from this disease. The total cost in 2008 was estimated at $300 billion. Now, to put that into perspective, the World Health Organization estimates that ending world hunger would cost approximately $195 billion. So basically, we're spending 2 times that just treating a condition which actually comes back to eating food, which is just insane to me. So obviously it's a problem that we're not getting a hold of, and the only way that we're going to make an impact is by helping people to become better educated in terms of taking care of themselves. And this is another big problem, is that most people, it's just a lack of education. Now, most people don't realize this, but the word doctor comes from the Latin word docere, and that means to teach. So the whole goal of a doctor should be to teach you how to be healthy, to teach you how to be well, so that way you can take better care of yourself. Because the reality is, and this is truth, you are your best doctor. You have an innate, inborn wisdom to be healthy, but you have to know how to do that. And unfortunately, most people, we've been brainwashed into the wrong concepts. Heart disease devastation continuing. 25% of children 5 and up already have plaque in the arteries. This was a U.S. News and World Report. Now, there are 3 different journals, the Pediatrics Journal in 2011, the Journal of Pediatrics in 2005, and then also Pediatrics in 2006. They determined that atherosclerosis has been shown to begin as early as 9 years of age. How crazy is that? So as early as 9 years of age, we're already finding plaquing of the arteries. So symptoms or signs of heart disease when you're 9. Unfortunately, you don't know you have it until it's too late, right? Because 75% of the time, again, 75% of heart attacks is first time. So you don't realize you have this problem, and it takes about 30, 40 years for it to show up. So 30 to 40 years for symptoms to show up. And this is where, even as a chiropractor, people come into my office and I look at their spines and they're damaged and they're young, right? I mean, I have 25-year-olds, 30-year-olds who will say like, wow, how did my spine get to be so unhealthy? Well, It's been going on for 20 or 30 years. You just didn't know it until now. And that's just an unfortunate part of it. The logic in this country is that you're healthy if you look good or you feel good. And that's just not right. We need to be seen whether we're healthy. And most people just don't have a clue as to how to see or what tests they need to have performed in order to know whether they're healthy. 90% of heart disease is caused by modifiable diet, not genetics. The medical establishment is still operating on outdated science from 40 to 50 years ago. So here's a question. What does medicine vigorously promote as the primary risk factor for heart disease? So what is the main cause? What does medicine say that's causing heart disease, that's killing people every day because of heart, that's causing your heart to go bad? What are some things that you can think of? Here's the answers. Cholesterol, number one. Saturated fats, and then of course your genetics, meaning like your parents died of heart disease or your grandparents died of heart disease. So they'll blame cholesterol, they'll blame saturated fats, and then they say it's genetics. And it's just not true. Today we're covering 50 years of research that says high cholesterol is not the primary cause of heart disease. Diets high in saturated fat and cholesterol don't cause heart disease. Consumption of heart-healthy vegetable oils are linked to heart disease, cancer, and many more, even though the American Heart Association will say that you need to increase your vegetable oils, which is just insane because we have research and it's been published saying opposite. Statin drugs, which is the #1 prescribed drug or medication in this country to treat heart disease, or blood pressure medications, do not reduce the risk of death for most people and even have dangerous side effects. So these are the things we're going to be covering. Here's a myth. Heart disease and cancer are normal with aging. Of course, heart disease and cancer are common, but they're absolutely not normal. And so this is another important thing to understand, just like we talked about a while ago. When we're, the average age is at 9. At 9, that's the average age of when we're starting to develop plaquing in our arteries. So this is something that begins when we're young, and it continues throughout our whole life. The good news is that you can stop it depending on your lifestyle, and depending on your nutrition and the things that you're doing. Here's another myth. Heart disease is my family history, so I'm going to get it. And that's just not true. Studies have demonstrated that other populations, which have the same high-risk heart disease genes and low-risk genes as Americans, do not suffer from the same fate. Meaning that there are other populations around the world that have the same genes that we do, but yet they don't die from heart disease like we do. They don't get cancer. They don't get osteoporosis. They don't get diabetes like we do. Cholesterol and saturated fats are not the enemy. Now, most of us grew up being told that foods like red meat, eggs, and bacon raise our cholesterol levels, and that that's a bad thing, right? That's what everybody's been told, that butter's bad, right? Don't eat butter, don't eat the egg yolks. The idea is so deeply ingrained in our cultural psyche that few people even question it. In other words, it's just automatic. But is it really true? And when you actually look into the research, and when you look at peer-reviewed medical journals, you'll find that it's not true. Truth is that cholesterol will not cause heart attacks or strokes. Inflammation in your body will. Truth, more people have heart attacks with normal cholesterol than elevated. There is a higher death rate with low cholesterol than high. Statin drugs, cholesterol-lowering drugs, do not change the mortality of heart attacks and stroke. These statistics were quoted from the New England Journal of Medicine. The diet heart hypothesis. So the diet heart hypothesis, which basically just says, this is the idea that eating cholesterol and saturated fat raises cholesterol in your blood, came from studies in both animals and humans more than half a century ago. However, more recent and higher quality research or evidence does not support that. And this is important to understand. So it's an outdated hypothesis, and we know today that it's completely false. We know today that cholesterol regulation in the body is tightly controlled. When intake from our diet goes up, the body reduces production of cholesterol. We know that. So if you start eating more cholesterol, your body's going to actually try to reduce production. However, when intake of cholesterol goes down, the body is going to try to increase production. So it's important to understand that. This explains why well-controlled studies that show that dietary cholesterol has very little impact on blood levels in 75% of the population. What that means is that 75% of the population, 3 out of 4 people, they can eat whatever they want, and it's going to have absolutely no impact on their blood cholesterol levels. Now, there are some people that they call hyper responders, 25% of the population, where if they eat cholesterol, they will have this adverse effect where there is an increase. But that doesn't mean that they're going to be at increased risk of heart disease. It just means it raises their cholesterol levels. And that's another bit of information we're going to get into here in a little bit. So what I'm telling you is that you need to stop fearing egg yolks. In other words, eating cholesterol isn't going to give you a heart attack. It isn't going to contribute to you having a stroke. In fact, egg yolks contain all the 13 essential nutrients required for healthy function, especially choline. And choline is a compound that it's a B vitamin. You'll find this in your egg yolks. And here's what's important. Studies show that 90% of Americans have choline deficiency. Choline deficiency can lead to fatigue, insomnia, poor kidney function, memory problems, and nerve muscle imbalances. So how many people do you know right now that have fatigue, that maybe have some sleep issues, that maybe their kidneys aren't working, they drink more water, they got to go to the bathroom? I mean, they got issues, right, with their kidneys. Memory problems, nerve muscle imbalances, muscle pain, nerve problems. Choline deficiency. And how many people were told that eggs are bad, and they try to avoid things like good healthy fats from something like an egg yolk? That's why we're seeing these problems. Lowering cholesterol levels is not healthy. A study in the Journal of Psychiatric Research found that men with low total cholesterol levels were 7 times more likely to die prematurely from unnatural causes such as suicide and accidents than other men in the study. A 1993 study published in The Lancet found that depression was 3 times more likely in men over 70 with low cholesterol than those with normal or high cholesterol. A Swedish study found that women with the lowest cholesterol suffered significantly more depressive symptoms than other women in the study. A study in the journal Neurology showed that low cholesterol is associated with increased risk of dementia. Here's another paper published in the European Journal of Internal Medicine, linked low cholesterol levels with Alzheimer's disease. So all this research here, and these are just a few journals that I picked, with some studies that are showing how lowering cholesterol actually has adverse effects on your brain. So much that it causes depression, causes dementia, causes Alzheimer's disease. And when you start to affect your brain, what do we talk about when you first come into our office? What do I say? The most important organ in your body. What is the boss of your body? What's the master controller that controls everything? All your organ functions, all your signaling, all your cells. It's your brain. And cholesterol is vital for brain function. So when you start to reduce cholesterol, you're reducing brain function, which means that everything else is not going to work the way it's supposed to. Consuming fat does not increase serum cholesterol, contrary to what people think. Here's a chart showing you how there's a linear relationship. So if you look right here, you'll see, okay, on the bottom of the graph here, calories from fat. So the more calories we eat, the higher our cholesterol levels go. That's what this is showing you. So you can see here along this line, where as you increase fat, you'll see an increase in cholesterol. So that looks nice and pretty there, but there are also these outliers way over here. So if you look at the Samburu, the Somalia, the Maasai Indians, over 60% of their calories come from fat, yet they have very low cholesterol levels. So that's an important thing to understand, is that there is not this direct relationship between increasing fat consumption and increasing cholesterol. Dietary fat and coronary heart disease. Summary of evidence from prospective cohort and randomized control trials. This was a paper published in the Annals of Nutritional Metabolism in 2009. Intake of total fat was not significantly associated with coronary events, heart attacks, or mortality. Fatal heart disease was not reduced by low-fat diets or by replacing saturated fats. In other words, taking animal fats out of your diet had no impact on whether or not you died from heart disease. Consuming fat does not contribute to heart disease. Continued. A large meta-analysis of prospective studies involving close to 350,000 participants found no association between saturated fat and heart disease. A Japanese prospective study, which followed 58,000 men for an average of 14 years, found no association between saturated fat intake and heart disease. And in fact, an inverse association between saturated fat and stroke. In other words, those who ate more saturated fat had a lower risk of stroke, or those who ate less saturated fat had an increased risk of stroke. The father of the lipid hypothesis, which is Ancel Keys, meaning this is the guy who discovered, who said, he's the one that propagated all this information and said, like, oh wow, fat's bad, cholesterol's bad. He even said, at the end of his years, at the end of his research days, he said that there's no connection whatsoever between cholesterol in food and cholesterol in the blood, and that we've known that all along. Adding cholesterol to an unrestricted diet has a minimal effect. In a 2004 editorial in the Journal of American College of Cardiology, Sylvan Lee Weinberg, former president of the American College of Cardiology and an outspoken proponent of the diet heart hypothesis, this is what he said: the low-fat, high-carbohydrate diet may well have played an unintended role in the current epidemics of obesity, lipid abnormalities, type type 2 diabetes, metabolic syndromes. This diet can no longer be defended by appeal to the authority of prestigious medical organizations. What he's telling you there is that by decreasing your fat and increasing your carbohydrates, your breads, your pastas, your grains, your oats, that's not a healthy thing. He's saying that those are not healthy, contrary to what the American Heart Association tells you. Mythbusters. Does eating cholesterol and fat increase cholesterol levels in the blood, thereby increasing your risk of heart disease? Absolutely not, and hopefully from the information and the research I just went over, you can see why that's just not true, and so you need to stop thinking that way. Does high cholesterol cause heart disease? So we just discussed how eating cholesterol has no impact on your blood levels, or how eating fat has no effect on your blood levels, or how those have no contribution to heart disease, right? So there's no difference. But here's the thing, what if you have high cholesterol anyway? Well, is that a risk factor? Forget what you're eating, but just whatever it is, if you have high cholesterol, is that bad? This paper reviewed 11 major studies, including 125,000 women, and determined that there was absolutely no relationship between total cholesterol levels and mortality rate. This was published in the journal Circulation. In older women, elevated serum cholesterol levels had been shown to be associated with longevity. In other words, the higher your serum cholesterol levels, the longer they lived. The higher the cholesterol number, the less mortality by all causes, not just heart disease, but cancer, diabetes, dementia, all of these other conditions and things that they were looking at. Dr. Ufi Raznikov's Swiss statin study, he reviewed more than 40 trials aimed at determining whether lowering cholesterol levels can prevent disease. Here's what he found. In some trials, he found that the rates went up. In other trials, he found that the rates went down. But on average, when all taken together, just as many people died in the groups taking cholesterol-lowering drugs as those with no treatment. So in other words, it didn't seem to have an impact, whether you lowered cholesterol or not. In fact, his research and his findings, they wouldn't even publish them in peer-reviewed medical journals. So he had to end up writing his own book to try to share this information, because he was getting a lot of heat from all of the editors of these popular journals at the time. There are dozens of studies that indicate lowering cholesterol is unhealthy. The Honolulu Heart Program study had 8,000 participants, and they found long-term persistence of low cholesterol concentration actually increases the risk of death. Thus, the earlier the patients start to have lower cholesterol concentrations, the greater the risk of death. This was the JLIT study, or Japanese Lipid Intervention Trial. Here's where they looked at 47,000 people over 6 years. And here's what they found. Cardiovascular mortality, so heart disease deaths in the lowest cholesterol group, was over 6 times the mortality rate of normal, meaning that the chances of you dying of heart disease in the lower cholesterol group was 6 times higher. So the lower cholesterol meant that you were 6 times more likely to die of heart disease. So the lower cholesterol had the highest death rate. Those with the highest cholesterols were safer. Dr. Malcolm Kendrick, MD, he compiled World Health Organization statistics from several European countries and results from urban Australian Aborigines. So comparison between heart disease rates in men aged 35 to 74 and average cholesterol levels in 15 populations. So along the bottom here, these are different populations that he studied. You had urban Aboriginals. So these were Aborigines that they took out of their natural habitat, their natural environment, and they were in cities. So they were eating diets that were very different from their genes, or what they were supposed to be eating. They looked at Russia, Spain, France, Poland, Italy, Denmark, all the way to Switzerland. This dotted line is the death rate, okay, of these different countries. The solid line is average cholesterol levels. So here's the thing, there's an inverse relationship. In Switzerland, the lowest death rates, while at the same time you had the highest cholesterol levels. Look at the urban Aboriginals. They had the highest death rates, even though they were trying to drastically reduce their cholesterol levels. So what they found here is this inverse relationship. Countries with the highest cholesterol levels have lower heart disease rates, and people like the urban Aboriginals, who had the highest rates of heart disease, had one of the lowest blood cholesterol levels. Here's another mythbuster. Cholesterol medications are safe. Well, truth is, they actually cause liver damage, neuropathy, severe joint pain, ligament pain, tendon rupture, muscle wasting, atrophy, headaches, fatigue, heart failure, depression. What's worse? Having high cholesterol and actually being protected, or getting put on a statin or cholesterol-lowering drug and having all these problems. It's crazy, but that's what we do, right? You get high cholesterol, you get put on a drug, and you get all these other symptoms. It's just insane, even though the research says that. Here's the logic. If cholesterol lowering medications work, we should see less heart disease. Isn't that correct? Like if cholesterol lowering drugs are working and blood pressure drugs are working, we should see less heart disease. But the reality is that even though we're taking more and more of these drugs every year, heart disease remains number one. Despite a massive use of statin cholesterol drugs over the past 2 decades, the incidence of heart disease hasn't changed. Most of the information that populates throughout mainstream medical society is based on faulty research and assumptions that have been passed down and then propagated by drug company and political propaganda. Billions of dollars have been made because you've been sold on this lie. Here's an analysis by Dr. David Newman in 2010, which drew on large meta-analyses of statins, found that among those with pre-existing heart disease that took statins for 5 years. This is his data. He studied people who took statins for 5 years, and these were people that had pre-existing heart disease, people who are already diagnosed. 96% of them taking medication saw no benefit at all. In other words, 1.2% had their lifespan extended. Okay, they were actually saved from a fatal heart attack because they were, 1.2% because they were put on this drug. 2.6% were helped by preventing a repeat heart attack. 0.8% were helped by preventing a stroke. 0.6% were harmed by developing diabetes. 10% were harmed by muscle damage. Crazy, right? I mean, so in other words, what's the point? And that's what I'm trying to tell you is that this stuff is not saving you, but yet you're continuing to take it. What then causes heart disease? If eating cholesterol doesn't do it, and eating fat doesn't do it, and high cholesterol, is not a problem, then what's the problem? Why are we dying from heart disease? Why are we dying from strokes and heart attacks and arrhythmias? Well, it's everything. And what I mean by that, it's at least everything that we're doing in this country. And that's typically diet, okay? And the main culprit behind that is inflammation. But what I want you to understand is that heart disease is multifactorial. It's not as simple as, oh, you've got high cholesterol, you're gonna die. Or you got high blood pressure, you're gonna die. It really just depends on everything else that you're doing. There are multiple factors that you have to take into account. And so there's not one thing that we should be doing, but there's many things we should be doing to protect ourselves from heart disease. So conventional medicine, this is what conventional medicine is focused on, symptoms. They will say, a doctor will say, if you have high blood pressure, I've got a pill to lower it. The problem is that that doesn't do anything for you. If you have high cholesterol, here's a pill to lower it. Again, the problem is that that's not impacting, that's not saving lives. And in fact, we have more people that are dying with normal cholesterol and normal blood pressure still dying from heart disease. They're still having heart attacks, they're still having strokes. So what's the point? It's quite obvious that that system is not working. Functional medicine, on the other hand, which is my approach when I'm treating lifestyle diseases, we take a functional approach. We're focused on the cause. I ask the question, well, why is your blood pressure high? Why is your cholesterol high? And that begins the process of trying to figure out why you're developing this disease. Here are some common causes. Number one is cellular inflammation. Cellular inflammation is basically when you eat a certain food, you have a reaction to that food, and it causes inflammation of your cells. Not inflammation that you get like when you sprain an ankle, but this is inflammation internally. And when this happens over and over and over again, let's say like at your arteries, it creates a reaction, a chemical reaction that actually causes plaque buildup. And then that, again, starts to result in the problem. We also see that thyroid disorders are associated with LDL levels. In other words, the bad cholesterol could be increased not because you have a heart problem, but because you have a thyroid problem. And these are subclinical issues that we need to look at. There's also infections. So ulcers, a bacteria called H. pylori, herpes even, infections in the body can begin to create reactions, biochemical reactions that are causing kinking in the arteries, that are causing arrhythmias and causing all kinds of problems in terms of cholesterol regulation. Gut dysfunction, this is a very common one, leaky gut, food intolerances, which with our standard American diet today, it's very common. Genetics. Okay, 1 in 1 million people will be affected by this. It's a very small number, but sometimes you just get a bad rap, right? Sometimes you just got a bad hand, and that's certainly a possibility. So we don't want to just ignore your genetics 100%, but there's a small chance. And typically, and they've estimated that about 2% of all conditions are really because of genetics. But in that case, usually people will end up dying by the age of 25, somewhere around there, and that's what studies say. Cellular inflammation, when you damage anything in the body, it starts an inflammatory process to heal that area, okay? So damage in the body, anywhere, inflammation begins to occur. When damage occurs to the lining of our arteries, chemicals are released to initiate the process of inflammation. Arteries constrict, blood becomes more prone to clotting, so that's where you get your clots. Ultimately, scars will form, so if you continue to have this reaction over and over and over again, say because you're eating the wrong foods, then scars begin to develop within the arteries, and we call that plaquing. Thickening of the arteries will result in blood together, or thickenings of the arteries will result in raising your blood pressure, which basically increases your risk of stroke and heart attacks. So that's how that happens from cellular inflammation. What are causes of cellular inflammation? Toxic diets. High sugar. We consume so much sugar in this country. High processed carbs, high industrial fats, high glutens, grain-fed meats. All these things you should be reducing or eliminating. Insufficient intake of omega-3 fats. Omega-3 fats form precursors for anti-inflammatory molecules. That's why they're such an important thing to be supplementing with. You have to be supplementing with omega-3s if you want to be healthy. Acidity levels of the body, poor diet, lack of circulation or exercise, chronic stress, all this will raise acidity levels inside the body. Free radicals or compounds that cause cellular damage, so alcohol, artificial ingredients, food coloring, dyes, compounds that should not be in our foods but are in our foods that we then ingest, and then there's a reaction that in essence causes inflammation. Poor recovery. So there are people that just move way too much with too little rest. Basically super athletes, right? These are people who overtrain and they don't give their bodies a chance to recover. So slowly they're developing this chronic inflammation. And this is where your marathon runner will drop dead from a heart attack. Or, you do have people who look really fit, but they end up dropping dead from a stroke or having a heart attack or developing cholesterol problems that eventually cause plaquing. Right? And so again, you have to take all these things into account. The sugar connection. Sugar, grains, refined carbohydrates, all of these cause increases in blood glucose levels. Okay, so anytime you eat sugar, and when I say sugar, people say like, oh, I don't add sugar to my food. Well, if you eat bread, within 5 seconds, that gets converted into sugar. Okay, so bread is sugar. White potatoes is sugar. Eating rice, it's about a minute later, it spikes your insulin levels. So all these things increase blood glucose levels. This increase in blood glucose increases cortisol, which is a stress hormone, as well as insulin. Increases in cortisol and insulin then increase an enzyme called PLA2, which increases inflammation. And that then causes an estimated 98% of all diseases, especially heart disease. Inflammation causes damage to the cell wall of arteries, leading to plaque, thickening, etc. So number one prevention strategy is to improve your nutrition. Poor nutrition, the best thing you can do to influence your risk of heart disease is through diet, because foods cause inflammation of the vessels. Of 52 countries studied, 90% of heart attacks could have been prevented through diet. So 9 out of 10 heart attacks could be prevented without drugs if they just changed their diet. Now, what did they find were the biggest contributors to oxidative damage or inflammation? Well, sugar was number one, mainly in the form of sucrose and fructose. Next was starch, so grains, potatoes, breads, pastas, rice, crackers, those types of things. Polyunsaturated oils, so the oils that the American Heart Association is telling you that's good were not found to be good, as well as trans fats. What does improved nutrition really mean? Well, when most people hear the phrase heart healthy diet or eat healthy, they think of egg white omelets, right? Just the whites, don't eat the yolks. They think of a salad and no dressing or low-fat diets, low cholesterol foods. The American Heart Association's Heart Healthy Diet emphasizes nutrient-poor foods, meaning they say eat foods that have low nutrients, such as whole grains and vegetable oils, and basically restricts nutrient-dense foods like healthy, lean, grass-fed meats, animal fats, which are just so nutritious for your brain, as well as cholesterol, which absolutely has no impact on heart disease. Do I have to eat a low-carb diet? Are fruits okay? How much sugar is too much? These are all questions that people eventually come up to and ask me, and it really just comes down to insulin and how your body responds to certain foods. So that's an important thing that we have to figure out for you. The number two prevention I'm going to say is carbs. There is a great study by Jeff Volek that looks at the results of carbohydrate-restricted, high-fat diets compared to a low-fat carbohydrate diet and the results on cholesterol. The two groups in the study were taken from a standard American diet, so basically normal regular diets, and they were put on a carb-restricted diet or a very low-carb, high-fat diet and a low-fat diet. So basically very low fats as well as a high carb diet. And they compared that and they looked after 12 weeks what would happen. So here what you're seeing on this chart, up at the top, let's start up here in the top left-hand corner, triglycerides were measured, meaning the higher your triglyceride levels is the worse you are in terms of health. And what they found here in the black line, you'll see this is the carbohydrate restricted diet on week 0. 12 weeks later, what happened to triglycerides? 12 weeks later, it dropped all the way down here. So pretty significant that when you restrict carbohydrates, it lowers your triglyceride levels. Now let's look what happens when you lower the fat, right? So here's the low-fat diet. You can see where their triglyceride levels were, week 0. And then week 12, it dropped the triglycerides, but not as much as the carbohydrate-restricted diet. So what this is telling you is that you're better off restricting your carbs than you are your fat. Now, when we look at insulin, how did that impact insulin? That's the bottom part of the graph here. You can look at the carbohydrate-restricted diet week 0. And then, of course, at week 12, of course, yeah, you see that it dropped insulin. Now, what did fat do? Did it do anything to insulin? Absolutely not. So what's important to understand is that eliminating fat does nothing for your insulin. And insulin is really the most important thing when we're trying to improve our diet, because insulin is what makes you store bad fat. Insulin is what increases cortisol levels inside your body, which causes damage to your cells. So that's why that's such an important thing to understand. Prevention strategy number 3, good fats. This is the component you want to increase the most while decreasing carbohydrates to help protect against heart disease. More important are saturated fatty acids like coconut oil, butter, ghee, and lard. These have all demonstrated protective against oxidation and inflammation and have many other important health benefits. This was the Journal of Nutrition in 2004. A study published in 2004 showed that saturated fat, so basically like coconut oil, beef, real butter, all this reduced alcohol-induced liver damage when substituted for polyunsaturated or what you would call heart-healthy fats. Prevention strategy number 3, continuing on with eating fats, there are several good oils that can be very helpful in reducing your heart disease risk. The higher the saturated fat content, the better. So here's a chart here that's showing you some of the best oils that you could be eating. And just so you'll see it, the more red there is, the better for your body. So coconut oil, butter oil, palm oil, lard, these are all very, very good for you. At the top of the list there, you'll see canola oil, safflower, flaxseed. These are oils that you should be eating moderately or minimally. Try to avoid them as much as possible. Don't eat these fats. The most inflammatory fat is basically trans fat. There are many studies that show heart disease and cancer risks because of trans fat. Even the FDA has said that reducing trans fat consumption could prevent 10 to 20,000 heart attacks and 3 to 7,000 coronary heart deaths every year. So here's a list of trans fats you always want to avoid. Margarine, vegetable shortening, anything that has hydrogenated, fully or partially hydrogenated oils. Other PUFA oils that you should avoid are grapeseed oil, sunflower oil, flaxseed, safflower, corn oil. These are all oils that you want to try to reduce or stay away from as much as possible. Now, you have to be very careful. You need to read the ingredients. Not how many calories, not how many sugars, not how many proteins. You literally have to look at the ingredients to see, does it have hydrogenated anything? Because if it has hydrogenated in there, it has trans fats. Even if it says 0 grams of trans fats, it can have it in there. That's allowed. Here's a graph showing you how polyunsaturated fats have increased over time. So you can see that from the 1900s, it was really low, and as we move towards the right of the chart, it just skyrockets. And as we've seen an increase in these so-called healthy fats, we've seen an increase in heart disease. So again, you want to avoid the consumption of those. Basically, when you put prevention strategy number 1, number 2, and number 3 together, when we improve nutrients, we increase our vegetables, and we increase good healthy fruits, when we decrease carbs and we increase good fats, that's called the paleo diet. And that's why, as a doctor, I recommend most of my patients take on some kind of paleo diet form. In other words, that's a very healthy program for everybody to be on, and it's practical. I think it's something that everybody can do. Now, there are different levels of paleo diets, and so if you need help with that, please contact me. But you could also visit our website here. You can familyhealthchiropractic.com /likes/paleo recipe. And that's a pretty good resource for a program that I'd recommend. Proper pH balancing and acidity. 1 can of soda has a pH of 2.5. It is 50,000 times more acidic than neutral. So it takes 30 cups of water to neutralize 1 can of soda. When pH is balanced, the cells of your body work the way they're supposed to work. When pH is imbalanced, when you're acidic, the cells do not work. So unless you balance your pH, you will never ever heal from any disease. When the pH in the body is lowered, the body will do everything it can to raise that pH. Your body will take alkaline substances from other areas of your body to normalize the pH. So basically, like osteoporosis and osteoarthritis, kidney stones, all these are basically pH conditions. Wherever acidic residues wind up, so wherever there's acidity in your body, that will determine the name that we eventually put on a symptom. So when you have too much acidity in your pancreas, you're going to develop diabetes. When you have too much acidity for your heart system, you're going to develop heart disease. When it's in your colon, that's Crohn's. When blood levels are too acidic, we call that osteoporosis. Or when your bones become too acidic because of abnormal weight or abnormal alignment for your spine, we call that arthritis. Here's another one that people don't realize, but maximizing your nerve supply. Yes, that can contribute to heart disease. When your spine is not in its proper position, you will have an increased risk of heart disease. Why? Because what connects to the heart? What allows your heart to beat? What organ tells your heart to beat fast or to slow down or to increase in blood pressure or to decrease in blood pressure? It's your nerves, and your nerves that come from your spinal cord, and your spinal cord connects to your brain. So your brain, which is the boss of your body, right? Your brain controls everything. Your brain sends signals down the spinal cord, out through the nerves that they go connect to your heart. So what happens if we were to cut the nerves that go connect to your heart? What would happen to the heart? It would obviously die. And so that's something that we cannot ignore, is that your spine, the alignment of your spine, which protects your spinal cord and those nerves, is essential to heart function. Here's a picture. This is a cross-section of a spine. And if you look up at the very top, you look up here, you'll see that there's some nerves. Right here are some nerves, or here's the spinal cord traveling down. This is a nice healthy curve in the neck. That's normal healthy alignment. Off and to the right, you'll see that this is abnormal alignment. Look how things are very straight. This is not the way your spine should be. And when we take an x-ray, that's where we're evaluating for. We're looking to see, is your neck straight or do you have a normal healthy curve? Well, what happens as time goes on, those individuals that maintain that curve, the spinal cord stays nice and thick, which means that you have 100% function of those nerves that go and connect to the heart. On the other hand, when you lose that curve as time goes on, look at the width. Look how small the spinal cord is here. There's a lot of compression that's being placed on those nerves, and we know that contributes to heart disease. In fact, there was a study that showed that chiropractic adjustments in the neck reduced systolic blood pressure by 14 points and diastolic blood pressure by 8 points in 8 weeks. That was published in the Journal of Human Hypertension in 2007. So what I'm telling you is that, again, heart disease is multifactorial. It's not just as simple as lowering cholesterol or lowering blood pressure. You have to modify diet. You have to rule out infections. Do you have a thyroid problem? Do you have a stomach problem? You know, these are all things. What's the best diet that you could be eating for you? Not because Dean Warner said you should eat this, or not because I said you should eat it, but what's good for you. These are all things that we can figure out, and if you need help with that, then please contact our office. You can call us at 512-347-8881. You could reach us via our website, which is www.familyhealthchiropractic.com. You could also email me. That's DRD, Dr. D, DRD, at familyhealthchiropractic.com. And if you have any questions about any of the information we went over, if you'd like to have some functional testing done to see whether or not you're at risk for heart disease, please contact our office and I'd love to help you. I thank you for your time. I thank you for listening, and I hope you guys enjoy the rest of your day.